Hey, Jeanette here. So I have a 25-year career in sales, but it all sort of started when I was in college. I actually started art school. I'm a certified art school dropout, and I went to, as I like to say, go on to get a degree in psychology, which is equally useless without a master's, right? Not that art degrees are useless, but certainly not the career field that I think my parents were looking for. So when I ended up in psychology, my last year there, we had required classes called uh, therapeutic communications. And in therapeutic communications, you were actually able to start to use some of the techniques that you learned in class. And they were with fellow students, so it wasn't real problems, it wasn't real clients, but we were able to see what these things would look like. And as I explored cognitive behavioral therapy, which was the most important or the leading technology at the time when it came to therapy, recognize that not only were insurance companies not providing long enough terms of care for their customers, right? The people that I'd be seeing would only get a minimum number of sessions before I'd have to send them on their way or hope that they'd continue to pay out of pocket. So, and in that time, they weren't actually getting resolution to their problems. And it didn't feel right to me to go on into this field that just wasn't getting the results. And I think anyone who's been in therapy will actually start to recognize that it didn't work for you, but you probably started to blame yourself or felt like you just weren't doing it right. Or you needed longer and needed to spend years with this therapist or find a different one to get your resolution to your problem. But what you might not have understood is underneath it is actually the therapeutic modalities weren't effective for you, right? So that's not something that we learn. The way that I put it recently to someone I had just met was just like you want to go to a doctor who will address your specific concerns, whether it's a cardiologist because you have a history of heart disease in your family, or a doctor who understands more concerns that are specific to the female body. Or you wouldn't take you want to take your infant to a pediatrician who understands growing a child bodies. You don't take them to a geriatric care specialist. The same is true for finding the right therapist, finding someone who aligns with your values and what you need and you get along with, right? These are very important qualities, but we're not taught to shop around for doctors. In the same way, we're not taught how to shop around for therapists. So that leads us to sort of conundrum. Number one, the methodologies that were available 25 years ago were not as effective as they are today. I found a number of techniques which are incredibly effective, and I use them with my clients all the time. Those weren't available to me back then. So you might have sought therapy years ago, it didn't work, and don't want to return to look at it because you think it's all the same. Well, trust me, there have been advancements. I don't know there have been so many advancements in the training, the typical training that people get in order to get their degree and start being therapists, but the additional methodologies that are available are phenomenal. So that's something to consider. The other reason I wanted to talk about this is I left a 25-year career in sales. That's a long time, and it was technology, all of it. It was in a male-dominated field. Most of them are really, but male-dominated field of technology sales. And it did well. All things considered, I was pretty successful, but why would I just give that up? I came to a crossroads in a particular situation that I had at my last employer, and I just thought, this is the time. This is the time that I can't keep pushing this cart up the hill. And what I didn't know, what I know now, is I was experiencing burnout. I was having a conversation with a colleague this morning, and she was talking about sales and burnout. I hadn't even realized that that's what happened to me. So if someone like me, who's a professional healer, right, clinical hypnotherapist, I have a background in psychology, I have all these techniques available to me, I've received so much therapy. If even I was unaware of my anxiety and my burnout, how can we expect the average person to be able to be self-introspective just enough to know what their problems are, to know that the help is available to them, to know how to find it. Right? It's just something that we want to consider. That had you looked at therapy in the past and received sort of typical methodologies that didn't work for you, just please know that there are better things available. You're welcome to contact me and I can explain a little bit more about that, or we can go into future sessions. If this is a topic of interest, I can make more of these videos. But the fact of the matter is, it's worth looking into because, as we hear all the time, everyone needs a therapist, right? Because our families have maybe not always given us everything that we need. And although we have friends who look out for us, they have a vested interest in us. There's a bias, right? That's not necessarily going to get you where you need to go. Your friend can show up and say that they support you and they want the best for you. And I'm sure that they do. And unless they're looking at the big picture and holistically understand how to get you from where you are to where you want to be, their support is helpful and caring and kind and sympathetic, but it doesn't maybe necessarily give you the tools that you need to move from one place to the next. And that's where a therapist comes in exceptionally handy, right? Because we are detached enough from the situation to see the truth of it and to help you see that as well. So I hope that's been useful and helpful for folks who have experienced, stressful sales careers, perhaps burnout from anything really. And if you've received therapy in the past that just hasn't resolved your issues or given you the help that you need, just know that there are tools available for you. Thanks.